Hello, my name is Yarabi. I am a student from Nurse Practitioner Program. I'm here to perform the physical assessment test from my school. This is the head to toe exam, and this is my patient. I'm going to pretend that I go out, knock the door, and go into the room. Hello. Hi, how are you? Good. My name is Jarabi. I'm here to perform a physical exam. Is you are okay? What's your name?
Joandra.
Okay, Joandra Gomez. Okay, you are okay that I make my physical exam with you. I only have 30 minutes to perform this physical exam. And this exam is when you're going to see you're going to be the head is in the midline in reference of her body, and the head is erect. Then the muscle of the neck is okay. And the first, I have to observe that both sides of her face is have symmetry. Then the eyes, eyes brown, lip, the nasolabial folds, and the symmetrical, and everything in her face, both sides of the face, is symmetrical. And then after I observe that in her face everything is symmetrical, I'm going to pretend that I wash my hands to touch her head and make the physical exam, the palpation, the physical exam. Then I'm going to touch the first one you observe is the distribution of the hair is according to the age and sex. Is the hair is black, the hair is smooth, and the palpation of the skull is no lumps. Is the distribution of the hair is evenly and normal. The skull is cephalic, and the scalp no have is intact and no have any depression or thumbs. Then my hand is a little hard. Now I'm going to palpate the temporal arterial, and this is, you can see, is no tenderness, no pain. And I'm going to hear the both arteries, temporal arteries, to have any bruise, and she no had. Then after here that she don't have any bruise in the artery, I'm going to have ask the patient to open the mouth. I'm going to palpate the temporomandibular joint. Open your mouth, close. No pain, no tenderness, no bruise, no any crepitation at that level. Then we can see that is the facial nerve is intact in the motor part. The trigeminal gate, to examine the trigeminal nape, I'm going to ask to the patient. I'm going to ask to the patient to follow me with some facial expression. Remember that she don't speak Spanish; they speak English. Then I'm going to make the expression this way. You can see. Make that like this. Close your eyes. Wrinkle your head. Well, both sides of the face are symmetric. Now I'm going to palpate the maxillar sinus and the temporal sinus. And we can see that she don't have any tenderness, any pain, and that level. After that, we continue examining that. Remember that she don't have any problem in the expression. Both sides are symmetric, and the facial nerve is intact for her. In the expression is present, and now I'm going to put something soft and something hard in her face to be sure that the sensory size of the nerve or the facial nerve is then. I'm going to touch her both sides of the face with something soft and with something hard. And she's going to say, if she is, okay, what she feel? Close your eyes, please. What do you feel? Hard or soft? What do you feel? Hard? Close your eye, please. Or soft?
Hard.
What do you feel? Soft or hard?
Soft.
What do you feel? Soft or hard?
Soft.
Well, we can see the sensory is on both sides are very good, no bilateral and conserved. And then now I'm going to tell, if you can please I'm going to ask, please, that you touch your nose with both your hands like this, and touch your nose with the hands. Now the other one a little faster. Now close your eyes. Good. Then we can observe that she don't have ataxia, and the movement are very coordinated. And now I'm going to observe your visual inspection of your neck. What is the most important? That the trachea is centrally is not have any deviation of your neck, and that your observe exactly that inspection. Can you swallow like this? Good. Then we can see that the trachea is follow the swallow movement. Okay. After observe, we can touch the neck, and we can observe the we can palpate the carotid arteries one at a time. Okay. Are we going to auscultate any bruise in both sides? She don't have any bruise in the carotid arteries. And then I'm going to palpate on the lymph nodes in her nose. We start with this occipital, retroauricular, preauriculars, retropharyngeal, submandibular, submentorial, supraclavicular, and infraclavicular. We not palpate any in the posterior or anterior chain, any tenderness on any lymph node swallowing or something like this, swelling. Then I'm going to ask to put a little bit for range of motion of the neck. The first we're going to be is can you look like this? Down. When this is the extension and flexion, it's the extension of the neck. After that, we're going to see what is the rotation. She can do it like this, like this. Then she don't have any problem to make this movement. The rotation like this, and the other side. Okay, she don't have any problem with the lateralization or rotation of the neck. Now I'm going to ask you push your head like this. Again, my hand. Okay, on this side, push to the other side. Good. Then you're going to push your shoulder, again my arms, my hands. Good. Then we can see that she can do it very good. No, achieve the full resistance to opposite movement, and we can confirm the spinal accessory nerve are intact from both sides. Now I'm going to feel it, make the examination of your thyroid, where it's located in the part of the anterior of the neck, And we can ask her with palpation one hand to swallow. And we can observe the thyroid follow the swallow movement of the trachea, and we can palpate any node and the thyroid. The normally is not palpated, only when we add to the patient swallow, and it's not, you can see that it's soft, it's smooth. You can say that it's not any mass or lump, and this plays through the swallowing movement. And now are we going to toward the chest of the patient, and her, you're going to do it like this, putting the chin perfect. Then you don't have any shake at the time, and it's good consider that this bilateral. Okay. Now we're going to evaluate the eyes movement. Then we have the observe. You have to follow my finger. Good. Both eyes, huh? 6, 4, and 3. Now you have to follow my finger. Perfect. Then she don't have any nystagmus. Both eyes move. Follow my finger. Perfect. All the 6 cardinal fields of vision move are conserved, and I'm very good coordinated. The next thing that I'm going to be confront is the confrontation test. How can I going to do that? I'm going to ask to the patient that she have to tell me when she throw my fingers in the and then now in her peripheral vision, when you saw my finger, you have to say, okay. Cuando veas mis ojos, you can only. Cuando lo veas.
Dos. Yes.
Okay, but the other side.
Dos.
Okay, then both sides of the peripheral vision, let me know that she is okay in the 90 degree. And then we can say that the confrontation test is intact visual field. Is everything is okay in both sides. Then the combination, I can gonna have you follow my finger. Perfect. Look up behind or there. All right. So pupillary accommodation. Now, what are you going to do? I want to observe how the pupillary accommodation is intact in both sides. How can I do that? She has she had to look, and I can see. Look here. And how when I go closer, open. The pupil is contraction, and then I can see the accommodation is intact. In both sides is okay, no problem. When she follow the closer or the object is closer, the pupil is converged. Then when she follow the objects like far or closer, the pupil is contraction, and when you put it far and closer, both sides can follow the object, and you can see the dilation or not the pupil. Then now I'm going to have to ask the patient. I'm going to examine the ear. The distribution of ear in both sides is very good. First, the top of the ear is good, line to the external angle of the eyes, and the bottom is in the is symmetrical bilateral. So I'm going to ask to pretend that I'm going to put in the light off to test is I'm going to look at my ear. Okay, you're going to look my ear. I'm going to pretend that we're putting the light off. I'm going to examine you have to look at my ear, and I'm going to examine the ear. Okay, the other side, you look my ear, and in front, and I'm going to examine it. Okay, in this case, so her pupils are okay, are equal, round, reactive to the light, and the accommodation is direct and consensual. So I going after look inside of her eye bilateralis, the red reflection was okay, and the blood vessel on the back was the arterial ratio or 3 to 5. There is the macula, and that's yellow, and I see the cream of coloring this no exudate on the eyes on this moment. So from the eyes, I'm going to go to the notes of a visual inspection of the nose. Okay, now I'm going to inspect the nose. This is my speckle, and I can see the both nares are symmetrical and the equally positioned, and there is a nice stable structure of the nose and at the same color of the facial and of the skin, which is the light pink to peach. And now I'm going to look, after look on the inside of the nose, I saw that is the septum is in the middle and the inferior turbinates where you are glistering pink and moist the septum. And you can see all the mucus, nasal mucus is pink and the septum is central. And nothing, you don't observe any nodes or everything is okay in both sides. After finish with the nose examination, we're going to examine the ear. And the both are symmetrical, normal configured. And you can see the article is horizontal inner and contours of the A's, and in the lateral position is less than 10, equal or less than 10 degrees. I'm going to look in your ears. I'm going to look inside of your ears. And you can observe, and I can observe the canal is no odor, no no secretion or fluids from the ears, and this the firm structure are stable. The cartilage is recoiled from folded position. After I push to the back and down and down, and then we can observe on the bottom of the canal the inner membrane that is concerned. If no swelling, no fluids, it's not irritated. It's pink like peach. Well, after that, she never asked about pain or tenderness in the ear. Then through the exam, the tympanic membrane, like inner membrane, what I said before, is translucent. This is the perfect color and it's not carried. It's translucent and reflect a little bit of cerumen that is normal because it's protect the ear canal. And after that, both sides is normal. After that, I'm going to continue to perform, after the perform the ear exam, I'm going to continue with the inspection of the mouth. We have to see the small palatal and the hard palatal. Open your mouth. Okay. We have in the heart, both sides are symmetrical, vertically and horizontally with the movement. The tongue, we have to pull out like this. It's important thing because we can observe the rest of the facial skin of the lips are pink. When we compare with the face, is the lip is more pink than the face, like a dark pink in color. Okay, so I will have uh, checking the buccal mucosa and this spin and the glycerin on gingiva is light pink, fair and moist or half, then have that she have all her teeth normal. She was every month appointment with the dentist every time that she go to take care of her mouth. Very good. She have the color is pearly white. Some of them is yellow, and she has 32 teeth that I can see. There in the top of her half, I can see the hard palate and it's dome shaped. And the protuberance of the our palate, its midline, it is continue with the soft palate. And soft palate is the nice pink color and the same with the hard palate. The uvula is in the midline and we can see that I can see that it's perfect. So the soft palate rise when saying ah, and when I have to stick the tongue out for the, you can see the pink is in color, anterior surface is smooth, and the posterior surface of the tongue is smooth. And a little slightly rise, and you can see her tongue is straight, and the blood vessel in both sides of the frenulum is okay. She don't have any leukoplasia or masses or stone that you can think that she have any problem in her mouth. Well, the tongue movement in both sides, not have any lateralization. Well, she moved very good the tongue to both sides, and that's speak about the hypoglossal nerve is intact. Well, she have the surgery of the tonsil. Then we can now observe this part of the tonsil. Not have any exudate any from the pharyngeal size. She's no have any exudate, no swelling, no redness. Everything is okay in the mouth. Now I am going to have to continue with the chest examination. Okay. We had to observe the patient and the chest patient anterior, posterior to one, and lateralize it. Then, in the side back, we have to observe too, because we have to observe if you have any in the skin, any change, if you have any retraction, or you can observe any the bone deformity that can provoke problem with the respiration rhythm. And after we observe the chest, anterior posterior diameter is to a 1 ratio, what I said before. We have to observe is the symmetrical and the chest expansion, even with the breathing normal. Breathe. Okay, I'm good. Then we can observe that both sides is symmetrical, and the normal respiratory in the adult person is between 12 and 20 breathing for per minute. No, here you can observe that it's not any accessory muscle use it, and any retraction between the rib in this then it is normal respiratory rhythm, and both sides are symmetrical. Then after that, I'm going to make the auscultation. And every time that you make the physical examination of the respiratory, you have to make anterior, lateralized, and posterior, both sides. And you have to compare the right side with the left side to show or to hear is the normal. In both sides is symmetrical, or you can hear the same. After you ask to the patient to make the deep breath, and you have to clear the patient, ask to the patient to clear breathe some to prevent that you don't hear adventitious breath sounds. Check your kidney. To check the kidney of the patient, I'm going to ask to the patient every time I'm going to ask rest both sides. No, I'm going to ask to the patient bilaterally. What I say it, I'm going to let me know is the patient are going let me know if she have any tenderness or pain when I'm going to examine this part. Percussion of both sides of the patient, the flanks, and she don't complain about pain or tenderness. It not cost over. I'm going to continue here. I'm going to first listen with the diaphragm or risu on the right side or intercostal space down to the aortic valve. To hear the heart sound, we have the four focus: aortic, pulmonary, tricuspid, and mitral focus. Then after here that everything is okay in the heart beat, we can continue follow with the no problem. The heart rate is between 60 and 90 beats per minute, and is you can hear listening the S1 on the apex of the hair, and the S2 will be in the base of the hair. And I'm going to feel further pulse bilaterally, but the time is very short. We have to I say the first temporal, carotidial, radial, axillary, inguinal, popliteal. Then both of the tibial and the plantar, all of them should be symmetrical. But the most important pulse that every time we have is the radial pulse, brachial pulse. Just want to feel right here in the femoral, okay, and the popliteal, and the posterior tibial and dorsalis pedis. And it was good pulse in all moment. You can feel bilateral, and the patient is okay about all this point pulse. When you observe the legs in the visual inspection, their even distribution over the arm and the legs, you are warm, cool to warm, toes. I do not see any edema or deformity or masses, no lesion. I'm going to just check your capillary refill. How you can feel the capillary refill in your nails. And your fingers, and should be less than 2 seconds to full or return the blood on the nails in your finger. I'm going to make the same in the two to be sure that she don't have any circulatory problem on the legs. After, see, the variation should be peeing on. She don't have any opacity, and the nails are smooth and the shape is convex, and there is no any problem in is the longitudinal beating and reading region, and looks good. Okay, we go lay. Now we're going to put in the patient lay down. I'm going to move this here. To see her abdomen. Okay, then to observe her abdomen, I think it's better in this position. I'm going to make the physical examination of her abdomen. The first that I have to do is observe the skin. She have any tums or mass that I can observe, or vascular vascular arachne, vascular, and everything, both sides of the abdomen, every side should be symmetric and not have any problem in the physical examination, in the physical observe, in the physical inspection. Well, no, she don't have any scar or striation. Well, I'm going to put it a little down this here. Okay, okay, and then I can see that she don't have any scar or striation. The umbilicus is all visible, and everything in the skin and the inspection is okay. And then the abdomen follow the breathing movement and not have any problem on the shape of the abdomen. It's rounded, and the maximum point is convexity. Is the umbilical. Here is the umbilical, when you can see the convexity. Well, everything in the skin is okay. How you can observe in the physical, in the inspection. Well, I'm going to defer after inspection. Then I'm going to hear in the ileocecal valve and in the stomach, and all the 4 quadrants are going to auscultate. And I had to hear almost 5 GERD in 1 minute to see that this is normal. And I'm going to hear the aorta, pulse, and the renal arteries, and the iliac arteries too, to see if she have any bruise, and she don't have nothing. Then after here, no friction, no roots, no venous humps. Now I'm going to just perk a little under. I'm going to make the superficial and deep palpation. To the superficial, I'm going to one hand palpate every quadrant of the abdomen with my 3 fingers. It's not too deep. It's only to see if she have any superficial. Then after I finish with one hand, I'm going to use both hands, and I'm going to go a little deep, start for the same size. And ask her she have any pain. After make this, we have to ask to the patient, go to the bathroom, make pee. To make the physical examination of the liver, we have to ask to the patient that breathe, Respira. And slow down. We can't palpate the liver over the rib, out of the rib. After the palpation and we don't find any tenderness or any tone, and we're going deeper of the physical examination, and the patient never asks question for pain or nothing, and then we can observe that the abdomen continue is soft, not tender, no mass. We can't palpate the liver under the ribs, and this is on the. After that, we can put the liver, the kidneys, and what we can do it. We're going to put in the no dominant hands under, and the dominant hand like this, and we can palpate. And the other side is the same. The no dominant hands under the body and the other hands over, and we can palpate the kidney and the spleen that normally is not palpable, only is this swelling. Then after finish with the abdomen, we can make the percussion of abdomen. We use finger with the same rotation. We can identify if have any mass in the patient abdomen. After this, the percussion of the abdomen, we can we don't identify any shame or the sonority of the patient. Then we're going to examine the legs and rotation of the hip. What we can do it. We're going to put in the back, observe if have any external rotation of the legs, and we're going to flex like this, both legs. Huh? Then after that, we can see as she is very good. Like we're going to ask to the patient, she don't have any dysplasia or dislocation of the hip. We're going to evaluate the flexion of the knee like this, and she have any pain or alteration. And another way to ask the patient, elevated the legs or rotation of the ankle. And she don't have any, both sides the same, don't have any alteration at this point. Then the extension and flexion, we're going to examine this. We ask to the patient to sit again. Please have the patient. And we're going to examine it. We're going to ask to the patient to to push again I'm going to push, and you're going to elevate the head, like this, push, both. Now the other, and she is okay. She don't have any problem at this point, and the push is perfect. And now I'm going to push down. Push, a fuerza en contra, eso. Now, yes, we can corroborate that the both sides of the muscle is muscle strength is conserved. She have the resistance and opposition movement, and the quadricep is no injury on both sides. The quadriceps is the same. It is preserve the strength of the quadricep. Another movement that I have to evaluate is the plantar flexion. And I'm going to ask the patient to push the legs. Push, push, yes. And now the other side, like this. Hazme lo contrario. Aquí, puja para acá, ahí. And the other legs, push. And the other side, then The plantar flexion is la dorsiflexion, but again, is she is the movement of resistance is very good. She don't have any problem about the resistances with the opposition and on the feet. Now, everything is okay. Now I'm going to evaluate the hands. Do it like this and like this. Flexion of the wrist and extension of the wrist. And now I'm going to bring the hyperextension like this. Chest, I don't have problem. See? Then I'm going to the putting your finger like this and push. Okay. Yeah, that is perfect for the movement or the exercise of the metacarpal flexion and metacarpal hyperextension or extension is very good. Now I'm going to do the two opposition. You bring your finger, abduction and abduction. Perfect. Perfect. Now I'm going to bring your wrist in inversion like this. And cream the finger. Good. Good. She can cream my finger the both sides. It's a steiner and hold my hands. Sweet. Good. She alternate the movement very good, no have any problem, and the reflex is very good. I'm going to check, evaluate her reflex. Close your eyes. You see it? Very good. Symmetrical. Close your eyes. So this eyes. Now here. Close your eyes. Okay, close your eyes. Look for this eyes. Good. Both sides of her body, when you explore the reflex, are very conserved. You don't have any problem. And the bicep, tricep, or all both sides are present. Then, okay, the Achilles reflex, all the time, the plantar flexion, all the reflex that I explored was concerned. Now, I'm going to ask you to explore the elbow strong. Push again, resistance. Now, I'm going to after evaluate the strength of the tricep and the bicep, I'm going to ask to the pronation and supination. So, it's like a version, like doing like this, and I like this. Okay, perfect. Okay, perfect. After that, I'm going to ask you to stand up like this. Perfect. I'm going to put it like this. I'm going to ask to flexion and hyperextension like this to see if you have good. Perfect. That is perfect. She have any problem with the flexion and extension. Okay. Now you're going to make this exercise. Look at me. You're going to make like this and like this. You see? Like this and like this. Perfect. Now I'm going to check is your greater trip Euler is symmetrical in both sides. I look your spine. Okay, you're going to stay here. And I'm going to check both sides of your spine is symmetrical. If you don't have any deviation, excuse me, if you have any deviation of your spine, both sides is symmetrical. And I'm going to ask you to touch your tooth. Tócate los pies. Perfect. We can see that she don't have any deviation in the... Now, ahora te vas a mirar por el lado, para el otro. That is perfect. Now do it as, like this. Muévelos así, mira. Mírame. Mírame así. Like this. Okay? Okay. Now, camina un poco para allá. Más. Camina para acá. Perfect. Okay. She have the symmetric motion. She have both sides on the same strength. Not have any problem to walk. To not have the. Now I'm going to make the sensitive, rumbar sensitive, like this. Now you're going to stand both sides. Close your eyes. Cierra los ojos. Ahora, aguanta, levanta un pie. Okay. She's doing very good. No had the sensitive rumbar. Test is negative. It feel like a blue through this. Well, now I'm going to ask to the patient to sit again. And that's it.